Good afternoon. It is 4 o'clock. It must be time for the senior moment. This is Connie Clark with Home Helpers. And this afternoon, I rounded somebody up. I walked into him in the aisle at Pilgrim's and talked him into coming in and talking with us this afternoon. It's Dr. Toby Hallowitz, and he is a doctor of naturopathic medicine.
That's correct.
And I asked him if he would come in here and talk to us about seniors and nutrition and the way that nutrition needs change as we grow older. And then as we started talking before we went on the air, my goodness, we just went off in all these neat little directions. So this is going to be a fun afternoon. Toby, welcome.
Thank you. Thank you for having me.
First off, I want to ask you, what is a doctor of naturopathic medicine, and how did you end up down that route?
Well, I always like to start off by explaining what it is that I do. So naturopathic medicine is licensed in 16 states. We're licensed as primary care providers. That means we do physical exams, lab work, imaging, prescribed pharmaceuticals, but our focus is on natural therapies like botanical medicine, homeopathy, hydrotherapy, nutrition, diet, those types of things.
So if I had something wrong with me, instead of looking at it going, okay, what kind of chemical can I put in your body to make this symptom go away, you would look at what I'm putting into my body that I should change. Like, for example, I'm a diabetic and I eat lots of candy. You would stop me from doing that to control the diabetes.
Well, what I like to do is I spend about 45 minutes with patients on an interview, and I like to go through your whole health history, including, what foods you're eating, what your diet is like, what medications you're taking, even what supplements you're taking. But I like to look for what's out of balance and what can I do to restore that balance to help you live a better life, both preventive medicine, but also to help you with current conditions that you may have. But let's look at what is at the root of any health problems that you do have.
Because we eat a whole lot different now than what we did not only, 100 years ago, but 50 years ago, 30 years ago, because of all the fast food things and all the things, the chemicals that they're figuring out. If I put this chemical in this food, it's going to make it taste better. So they're going to do that. So we eat a whole lot different than we used to.
We do. Probably the most popular diet today is the SAD diet. Do you know what the SAD diet stands for?
You said it earlier. Something American diet.
It's the standard American diet.
Okay.
It's the SAD diet. And so, it doesn't take much to look around and to see what a lot of people are eating. We weren't designed to drink 2 liters of soda today with all the sugar that's in it. We weren't designed to eat all this fast food that we're eating, for the fried food. And we have different, even when people are trying to eat healthy, we don't always know what's the best option to do that. If we had to simplify it, we know the most important thing is to eat as much whole foods as possible. But I'd like to share something with you. You asked how I got into natural medicine, and that kind of can relate the story. So, my father was a medical doctor who ended up specializing in chronic fatigue syndrome. And I was familiar with alternative medicine at an early age. I knew I always wanted to be a doctor, but that I came to realize that I didn't want to be a medical doctor. I was an early acceptance into medical school while I was in college at the University of Rochester in Western New York. And I was fortunate enough to have a great professor who taught history of medicine, and I saw where the profession was going with all the HMOs and just all the difficulties that one encounters and sort of being limited, maybe not necessarily dealing with all the things that we want to deal with. So I was kind of lost for a while, and I had to deal with, I knew that I wanted to be a doctor, but I knew I didn't want to be a medical doctor. And I was fortunate that I learned how to paint, and I did graphic design for a while, but it still wasn't my true calling. And at the same time, I had to deal with a lot of emotional things going on at home with my family that was really hard for me. And so for a couple years, emotionally, it was just a really tough time, and I got really sick. I developed Crohn's disease. And that's a condition where the body attacks the intestines. I had lots of diarrhea, vomiting, pain. I was very, very sick. A lot of this, as I later came to realize, was based on my nutrition, my diet growing up. I had liters and liters of soda a day. I remember having cupcakes and
all of
ho-hos
us
for
did
breakfast.
that. Yeah.
My
Pop-Tarts.
I bragged to my friends my favorite breakfast was leftover Chinese food, pizza, and chocolate pudding.
Oh, my goodness.
So I really did not eat well. And even my father, who was a medical doctor, maybe didn't always put it together about nutrition. So I'm fortunate enough that I met my wife. She's from the mountains of Austria near Innsbruck. And one summer, a couple years after I graduated from college, her father worked up on an alm that summer, which is a place where the local villagers take the cows up to graze on the grass. And they also, a lot of people hike up there, and they have to serve and feed the people who come up hiking. And anyways, it was a lot of work, and he was overwhelmed. So my wife Brigitte said, "Come on up and let's help out. Let's help out Brigitte's father and Brigitte's mother, who were having a tough time up there." So we did that, and I was up there high on this mountain for 2 weeks, and I ate nothing but
good stuff.
Yeah, whole foods, mostly vegetables. She made bread, homemade bread from dinkel, which is sprouted spelt flour, mountain spring water. I was in the most gorgeous nature. I was able to rest, and for the very first time, I did not.
You weren't sick.
No, I didn't vomit. I didn't have pain. I was doing so much better, and it was a really amazing experience. And I really had a calling there to know that I wanted to not only become a doctor who specialized in this, but I also wanted to help teach people how they can change their lives around. So after I got down off the mountain, they didn't have Google back then, but I used the current search engine and typed in Natural Medicine College, and I found out about the National College of Naturopathic Medicine in Portland, Oregon, and it was smooth sailing from there. Everything just fell into place, and I did a 4-year program usually it's a 4-year program for naturopathic medicine and a 4-year program for acupuncture, but I did a dual degree program for 6 years, and spent a lot of time in Portland and the Northwest, and just absolutely loved it. And thrilled. In fact, actually, that's how I found my way here. I went back to Western New York for 7 years, and
we called you back.
Yes.
That's really neat.
In Coeur d'Alene in the north. So I've been here for a year, and this area is just so beautiful. We just love the nature, and we love the people out here, and it truly does feel like home for us.
I love that story, because every time you meet somebody here that is from a different part of the country, like me, a transplant, it's interesting to find out how they found us up here. I say us like I've been here my whole life, but how someone found up here. And you come up here, and it's just so beautiful. We are so fortunate, and you and I were talking earlier about that we have access to, all this grass-fed beef and all these whole grains and everything. We're in the perfect spot to be healthy. But like some of us that have moved here from somewhere else, we have grown up on these very unhealthy paths. I mean, my breakfast was a Pop-Tart, and so that has done things to our body as we have grown. And now, like myself, approaching the 60th age, we start thinking, what have we done to ourselves all during this time period? And now this body that I wasn't really paying attention to has got to last me another 20, 30 years. What can I do now to fix some of the things I did in the past that will make me healthy enough to continue on?
Well, yeah, I think that's a really important question. So I like to look at what's out of balance, and diet is certainly a big thing, but there's more. There's exercise. There's being, I think, involved in nature, and sometimes the way we look at things. But when it comes to diet, you can't. And I work with patients on this. It doesn't happen overnight, but the more you can go to whole foods and stay away from fast foods and sodas, things that are very high in sugars, and the processed foods with the dyes and artificial flavors, the much better off you're going to be. And it may not happen overnight, especially changing your diet, but the way that you feel, but it's going to lead you in the right direction. And that's the most essential thing is everybody I work with, how can we get you more in balance? How can we get you eating the way that our bodies were intended to eat, the nutrition that we're supposed to have, the vitamins, the minerals. I mean, we know the research is out there that shows the benefits of eating organic, and that organic produce will be higher in nutrients. So you might have to take little steps to get there, but there are plenty of resources and people there to help you. And that's why I'm thrilled to be at Pilgrim's Market, is to have access to all of those foods, those whole foods, and being able to help educate people about what are the best choices that you can make.
I mean, one of the things that we face as we get older is our bone density. I mean, I think it's age 55, I believe, I was required to start getting bone density tests, which I never even, that wasn't even something on the top of my list of what I was thinking about. And as I'm getting them each year and looking at the numbers changing, it starts scaring me in that, I'm getting close to that line of the osteoporosis line, and I'm thinking, what am I going to do? I can't sit and eat, gallons and gallons of cheese or milk or whatever, thinking that's where I'm going to get the calcium from to build my bones. So you kind of go into this panic stage. Now what do I do? Because if my bones keep, getting brittle, I'm terrified I'm going to fall. And if I fall, I'm going to break something. And then that's going to, snowball into something else. So what would you do? Like if me, for example, I'm going into my 60s, my bone density I see is getting worse. What would a person do in that situation?
Well, what's the number one thing that most doctors or practitioners or even, the lay public, what do we think of when we're concerned about osteoporosis? And you know the answer to that. Everybody says
calcium,
right?
Well, that's what I was thinking. We don't drink milk like we used to when we were kids, so.
well, here's the problem with that. A lot of people, that's the number one thing that, people over age 55 come in and they're asking me, what form of calcium and how much should I take? Or we know how many doctors are recommending take, 1,000 milligrams of calcium.
And you see the commercials on TV. Yeah.
Yeah. So what we're actually starting to see is the problem is so much deeper than that. The problem is not just calcium. So what we're starting to see is that we're seeing a rise in cardiovascular disease. We're seeing more heart attacks and strokes, and a lot of this actually has to do with calcium precipitating in the coronary arteries, and also in our peripheral tissue, for example, like into our joints, and part of why we're getting arthritis. So there's a nutrient, a vitamin called K2. It's different than K1. There's some similarities to K1, but it's a vitamin called K2, and it's really essential for working together with calcium and vitamin D. Vitamin D, as you know, is in the news. Everybody knows how important it is to have vitamin D, and that if you're deficient, that it can be cause of osteoporosis.
And that's an issue here because of the winters and
right, and the latitude that we're at, that we just don't get enough vitamin D. And many doctors are ordering vitamin D now. Even conventional medical doctors order vitamin D labs now, whereas 5 years ago that didn't happen. That's because of all the research. We know how important vitamin D is. But what we're seeing is that even people taking vitamin D, I think the figure was like 30% increase in heart attacks, and we think that's because the calcium is precipitating in the coronary arteries because we don't have the vitamin K2 to work with the D and the calcium to make sure it goes into your bones. We know that vitamin D is really, really important for preventing osteoporosis, but also autoimmune conditions, cancer. We're finding K2 has many of these same functions, and that's because it's a fat-soluble vitamin, and these fat-soluble vitamins we're really deficient in, and vitamin K2 is not in our diet.
I was going to say, what is it normally in that you would eat?
It's very high in grass-fed meats, grass-fed dairy, grass-fed organs, and eggs from chickens who eat grass. So we're fortunate, working at Pilgrim's Market and being in this area where is a lot of grass-fed farming, that we have those products available. But how many people are eating that? How many people are drinking milk that is from cows that are eating grass? So even if you are, we're still probably not getting enough vitamin K2. So I really feel like it's essential to take a K2 multiple vitamin together with your vitamin D and calcium. And then there's a whole array of other nutrients that have been found to be supportive, like boron and strontium, magnesium, manganese, magnesium. We know that these things are all really important to work together with calcium and vitamin D. But one thing that's missing, and we're seeing the research explode on this, is vitamin K2.
Is that in only like the grass that they eat, or is it in leafy vegetables or
Well, it's the
anything?
bacteria that process it
Oh,
in
okay.
these animals, and that's how they process and they're able to make the vitamin K2. It's
Okay.
structurally similar to K1. K2 shouldn't. The research is fairly consistent on this, that it doesn't affect the K1 the same way or it doesn't affect warfarin, for example, like K1 does. So it should be safe to take even if you're on Coumadin warfarin, but you need to be careful with that. That's one thing why it's good to work with a professional to make sure
Okay.
that it won't interact if you are taking Coumadin. But that's pretty much the only thing that you'd have to worry about with K2 as a vitamin.
Okay.
But we know that it has all these other beneficial effects as well.
Interesting. So, okay, so you take calcium, you take vitamin D, and there's a lot of numbers after D. I've seen.
D3 and D2.
Okay.
So D3 is the natural one that our bodies take the ultraviolet rays from the sun and make vitamin D out of it. It's through our
okay.
livers, and it's a whole biochemical process that our bodies do. Now, D2 is a vegetarian form, and it's been assumed that D2 will have the same function as D3, but there's more research coming out that's showing that D3 is probably preferable than D2. So if you're going to take a D3 supplement, I would try to take D2. And it is possible to overdose. People are really scared about high levels of vitamin D. We know that the limits are much higher, and it's really safe to take vitamin D for the most part, but it's a good idea to get your vitamin D levels checked, because you may be taking vitamin D, and this happens all the time when I test patients' vitamin D levels. They could be taking 2,000. Even I had a patient today who was taking 6,000 IUs of vitamin D, and we tested their blood, and their level was 18. 30 is what's considered normal. Now, most doctors who are in the
So their body wasn't absorbing it.
right, maybe it wasn't the right quality. They probably needed even more than that. So when you're standing outside in the sun, your body will make anywhere from 20 to 30,000 IUs in about a half an hour. A lot of it depends on the latitude, the skin color, a lot of these different things that are what make people unique. But 20 to 30,000 in a half an hour, I mean, that's a high amount. Here's something that's interesting if you don't know this about vitamin D, and it affects everybody, but particularly the seniors. When we look at why seniors are asked to get flu shots, it's because they're one of the most vulnerable groups of people who can get the flu.
Right.
Well, why is it that the flu only happens or primarily happens in the fall and the winter? Well, epidemiologically, we can look at it and say that it has to do with the amount of sunlight that we're getting. Because viruses, it's a pandemic, the flu, it goes around the world. But why is it that it's only and it doesn't matter where you are in the world, it's always in the fall and the winter? Well, that's because the sun is
And you don't get that vitamin anymore.
is deficient. We don't get as much D, and so that's why we start getting our immune system is down. And we know that by taking vitamin D or getting your vitamin D levels up, that's one of the best ways to prevent the flu.
Interesting. Well, we need to take a break, but I want to continue. You are just so interesting. We will be right back. Usually they do something that stops those things.
What is that?
There's programs going on right now.
Okay.
And when the commercials come on, they come on. And when they're here, they take them off for me, but they put me on the air and then they took off.
And nobody is.
Nobody-
Can they hear that? Do you think was this picking it up?
Well, I hope not.
Yeah.
But now that Lee hears me talking about it, he knows what it was. Okay. So, all right, we're going to continue on. I want to go now. Let's go the path of as you get older and you put on a little bit of weight, a lot of people start getting near to be diabetic. Their blood sugar counts start going up, and the kind of where that comes from. Is that okay?
Yeah.
Or was there something else different direction?
I do, if it's possible, I want to comment though on the osteoporosis.
Okay.
For a
Okay.
moment.
Okay.
And then we can talk about blood sugars, and also I'd like to talk about inflammation, arthritis, too, because that's a big one.
Perfect. Along those same lines.
Yeah.
Okay.
And I'm not sure where I'm going to go with diabetes. I give that.
Okay. No, then we
osteoporosis
won't
talk
even
all
go
the
there.
time.
So we'll continue on this conversation.
Okay.
Okay.
And then we can lead into inflammation, arthritis.
Yeah. Okay. All right. And we're back. Welcome back to the Senior Moment. Again, this is Connie Clark with Home Helpers. And this afternoon I have Dr. Toby Hallowitz here, and we're talking about nutrition and what you put in your body and how all of us did all these bad things putting into our body as we grew up. And now we're getting older and we're starting to have to pay for all this stuff because our body doesn't really work like it used to. And we were talking about going in and having bone density checks. I have to do them, and I see now those numbers increasingly getting worse. And we talked about how calcium isn't the only thing that affects that. That there are other things that we need to think about, the vitamin D and vitamin K2 you were saying. Yeah. Can you take K2 as a supplement?
You can take K2 as a supplement, but it's also really beneficial to eat grass-fed products, dairy products, meat products. Butter, grass-fed butter is a great thing to do. It's very high in K2. And the other thing is, if you notice, like with butter, when it's naturally more yellow, that means there's more beta carotene in it. It's because the cows are eating grass that is growing. And when the grass is growing, they're going to be much higher in nutrients. So when we talk about looking at what's out of balance in our lives, we know that the way that meat is processed and the way that even dairy is done, it's so important that these animals are being pasture fed. So try to eat that as much as possible.
And a lot of them aren't.
And the more yellow that it is, you know that there's more nutrition going into it. That's what gives it its color, especially if it's natural. So that's really important. I'd like to state that we always think of osteoporosis as being a geriatric or senior condition, right?
I was hoping I wouldn't get this earlier, yes.
But the thing is, it's actually a pediatric condition.
Really?
Yes, because it's so important that children are building their bones while they're growing up, so that the bones are strong and they meet the maximum density. And it's not just the density, but the consistency and quality of the bones is what's essential. So that when you start losing, because it's normal, every woman who goes into menopause is going to be losing some bone. So the higher it is and the better the quality, that's the essential preventive medicine. And so we need to be thinking about we can do these things for ourselves, but it's imperative that we think about our grandchildren, our children, and making sure that they're eating that way, that they're not drinking the soda, and that they're eating the grass-fed dairy, which is giving their K2, so it's strengthening their bones right from the beginning, and that they're getting the right amount of vitamin D. Other things that are super important that I think everybody should know is probiotics. How important probiotics are to your health, and what probiotics are the good bacteria that we get in yogurts, for example. So I actually work with a lot of seniors who end up getting diarrhea, and for a lot of different reasons they get diarrhea, and they, whether it's C. difficile or having Crohn's disease. I ended up sort of specializing in dealing with gastrointestinal conditions like Crohn's and colitis and IBS. And I can tell you one of the most important things you can do is making sure that you get regular bacteria entered or probiotics in your diet on a daily basis.
Is that what probiotics are, or bacteria?
That's what they are. It
Okay.
means for biotic life, for life. And basically we have a symbiotic relationship with all these bacteria that when you have the right ones in your gut, they are helping you digest your food and assimilate those nutrients so that you can absorb them and utilize them. And they break things down so that we can use it. Without the bacteria, we wouldn't function. And so anytime that you've had an abnormal, anytime, let's say you've had an antibiotic, that we know that changes the flora or the types,
because that kills the bacteria.
It kills the good bacteria, and it can establish a pattern where you have these other bacteria that we can call bad, but they're just out of balance. We all have them, but they need to just explode and take over. And so you can do things to kill off the bad ones, but they'll keep coming back. This is something that I learned about that I think is really helpful to understand. By the age of 2, our bodies determine what is the normal amount of bacteria in our gut. So it's like a set point, like how our bodies tries to regulate our temperature. Well, through our immune system, our bodies try to regulate the type of bacteria that are in our intestines. And if you had, let's say you're a child and you had lots of ear infections, and you had antibiotics. You had at least 1 or 2, or some people have multiple.
I know a lot of mothers who have had children with lots of ear infections, and it seems like every other month they're on another antibiotic.
So those bacteria in that child's intestine are going to be off. Well, by the age of 2, the immune system says, well, that's the set point. That's what my body thinks is regular and normal, even though it's not normal and not regular. So you're always going to have to ingest bacteria. I mean, we live, for thousands and thousands of years, we didn't live in a sanitary environment where there were no bacteria. We got our bacteria from eating the foods and touching things and putting them to our mouth. And so there are many people out there who recommend that we actually lick leaves. And I think we're a little bit too...
I don't know that I do that.
But anyways, the point is that we need to get bacteria into our digestive tracts at a regular basis. So especially if you've had those problems, even if you had, the point about the set point is that if you had an antibiotic, we know that it changes the bacteria that are in your system. Now, with time, your body's going to go back to that set point. Even if you take a probiotic after that antibiotic, with time, your body's going to eventually establish that set point of bacteria. And so which is not a healthy set point for most people. So you're always going to have some sort of probiotic, whether it be a supplement, or I also recommend that you get it through good quality yogurts. One of my favorite yogurts is the Stonyfield Farm yogurts. There are other good ones out there, but I found therapeutically, I like to use that as a supplement. There's kombucha tea, which is fermented green tea.
Oh, that stuff's awful.
Oh, it is wonderful.
I've tasted that.
Well, there's multiple kinds out there. Try one. And if you're into... it can be fun to make a kombucha tea, but there's different yeast and bacteria in there, and it ferments the green tea, and it's a live drink. Now there's kefir as well that can be really tasty, and if you're sensitive to dairy, there's soy yogurts, there's rice yogurts, there's goat milk yogurt, almond yogurt, coconut yogurt. So there's all these ways to get this bacteria. They make chocolate bars that have bacteria in them now. So you can find ways to get that in, and I highly recommend that.
Yeah, I tried that stuff one time, and tastes like drinking vinegar. Okay, so now you're taking all these things, and you get like me now. I'm starting to get arthritis. I mean, I can feel it in my hands. I can feel it in my knees. I mean, that's a whole nother animal other than the osteoporosis, right?
Well, we have an epidemic of inflammation, and it does relate to how I think everything does in some way connect to our intestines. We know that with osteoarthritis, some of that has to do with calcium metabolism. So that's why it's important to have the vitamin K2 and the vitamin D, and that can help make sure that the calcium is not being deposited where there's a lot of wear and tear. But we know that there's quite a bit of inflammation, and some of that has to do with our diet. Some of it has to do with even the bacteria that are in intestines, because if we don't have the right bacteria there, we can have inflammation in our intestines, and we could have something called, you've probably heard the term leaky gut. That means that there's sort of spaces between the cells in our intestine that allow proteins that shouldn't get into our blood supply get into our blood supply, and that can cause a reaction and lead to autoimmune conditions like rheumatoid arthritis and like thyroid, problems with your autoimmune thyroid conditions, lupus. A lot of these autoimmune conditions, we think that there could be some connection to imbalances and problems with the gut. So I always feel like it's important to help normalize the gut, and the best way to do that is, one of the best ways is to use probiotics. But dealing with inflammation in general is going to be really, really helpful, and there are a lot of natural ways to do that. Fish oil is one of the best things that you can do to help with inflammation, to help cardiovascular disease, prevent heart attacks and stroke, high blood pressure, cholesterol, and then inflammatory conditions that we generally think of like osteoarthritis and rheumatoid arthritis, and even osteoporosis. We know that that's a big factor. We know fish oil helps prevent cancer and is super critical for any autoimmune condition.
So you hear and you see on TV, they say glucosamine and chondroitin for joint problems. Is that a fix, or?
It definitely helps. I mean, there's good research out there. There was a time when medical doctors would say, oh, there's no research on it, but there's lots of research on there. Now, I would say, if you're going to take glucosamine, make sure you take the right form. Most of the research that's successful, or studies that have shown that glucosamine is helpful, is looking at glucosamine sulfate. So I would recommend the glucosamine sulfate form. And if you're going to do it, you want to take therapeutic levels, so 1,500 milligrams of glucosamine sulfate if you're going to take it. You can have formulations that have MSM in it, for example.
Now, what's that?
they're these same thing with chondroitin. These are connective tissue metabolites that help support your connective tissue. I would highly recommend that people also do things that our ancestors did, and that if you look at all these cultures throughout the world, they've always included bone broth soup. So if you take bones from organic grass-fed cows and you make a soup or broth out of them, you're going to be getting the base materials of the connective tissue to help support your cartilage. That's what you're getting when you take glucosamine. Most of the time glucosamine is made from shellfish, but these are the building blocks of your connective tissue. And so by getting bone marrow and by getting, trying to eat tendons and ligaments and even, intestines and organ meat, it's very, very healthy for you to do that. And if we look at traditional cultures, like my wife being from the mountains of Austria, they have really they have great recipes for using these products, like liver or making soup or the bone marrow. My favorite soup is one of my favorite meals is actually taking liver and grinding it up and making ground liver and then mixing it into actually sprouted grain bread, and you make these balls with it. It's called canoodle, liver canoodle, and you put it in the bone broth soup, and it is really, really good and really healthy for you. So finding these ways to use these animal parts that are actually supportive to our tissues, a natural way to get that. And that's probably one of the reasons why we have more arthritis and problems with our joints, is because that is excluded from our diet for the most part.
Yeah, that's not something that I normally eat. So yeah. It's definitely excluded from my diet.
But there are ways to cook these things so that they taste really good. Now, I didn't grow up eating that way. I didn't grow up eating any fish at all. I was made fun of for not even eating fish sticks. But when I went to school and I knew, having had Crohn's disease and being in medical school, I'm like, I got to open my mind up. I got to see these things. So being in the Northwest, we know how, we have a lot of wild salmon available here, which we do not have as ready access to in other parts of the country. And so I basically made myself eat salmon. And so for the first few bites, I was forcing it down. I really didn't like it. Then I tolerated it, and then I actually liked it. And then the next thing you knew, I was eating it raw.
Ooh,
sushi.
okay.
Sushi.
Yeah, I know. I'm not quite there yet.
But we were designed to have, we can look back and we know that we were supposed to have a close to a 1-to-1, really a 4-to-1 ratio between omega-3 fatty acids and omega-6 fatty acids, which are really high in our modern diet from vegetable oils. And when that balance is off, it could be anywhere, like now there are studies that showed it could be as high as 50-to-1. But a lot of times it's around 25-to-1, and we need to correct that imbalance. So I think it's really important for people to take fish oil. Now, here's the thing: if you take fish oil, you've got to make sure that it's not rancid. How you know it's rancid is if it tastes fishy. Fish oil should not taste fishy. Now, it doesn't sound like you've had sushi, but if anybody's had sushi, you know that it doesn't taste fishy at all. And that's because it hasn't been oxidized. The fats have not gone rancid. Once you start getting rancidity, then it has a fishy taste. So any fish oil that you take, if you're taking a gel cap, bite into it. If it tastes fishy, do not take it anymore. And you need to keep your fish oil refrigerated. Here's the other thing.
The pills fish oil refrigerated?
For the most part, I would, yeah.
Really?
Mm-hmm. Because that'll help prevent rancidity.
Okay.
And
I didn't know that.
The thing is, you can see on a capsule or on a gel cap for fish oil, it'll say 1,000 milligrams. Well, what does that mean? You really got to focus on the EPA and the DHA, the two components of omega-3 fatty acid that we're looking for. Those are really essential for helping with inflammation. They are critical for helping with depression and anxiety, seasonal affective disorder with the vitamin D. But there's quite a bit of research of how important that is, not only for emotional health, but for inflammation and and a lot of that is because we look at what's out of balance with our bodies. We just don't have that in our diet the way that we used to. And so we have to focus and make sure that we get that amount or raise our levels of EPA and DHA. So when you look on a bottle, look at the amount of EPA and DHA you're getting per serving or per capsule. If you have no health problems at all, which then you're probably okay getting 1,000 milligrams of EPA and DHA. But if you have an autoimmune condition, or you're dealing with depression, or arthritis, or Crohn's disease, or there are many
Lots of
conditions,
ores, yeah.
where research has shown it's essential to get higher amounts of fish oil. You might even need to get up to 3,000 milligrams. So there is potential that it could thin your blood if you're on Coumadin. There's some other factors. So always work with a health provider or somebody who's in the know-how to make sure you're getting the right levels. But you really need to be aware of how important fish oil is, and you have to get good quality, should not be fishy, and you have to get therapeutic levels. If you're just getting 180 milligrams of EPA and DHA, that's not doing
There's
much
no
for
reason
you.
to be taking it.
And if it's rancid, if it tastes fishy, it's going to cause harm. It's going to be worse for you than taking nothing at all.
Interesting. Very interesting. Well, we need to take a break. I could sit here and talk to you for hours, but we will be right back. I'm going to put mine in the refrigerator. Is it okay if I go into the cholesterol route or no?
Yeah, we can talk somewhat about that. Obviously, I'm in mainstream medicine, so I have to deal with making sure cholesterol's down. But I think there's so much more to cholesterol. Just having high cholesterol is not the, and I don't want to get into that on the radio about
Okay.
that. Yeah, I'm not sure. So yeah, I guess just talk about some basic things that are helpful for cholesterol.
And what I was going to do was mention the video that I saw, because I know it's going around town because everybody's talking about it, and how that we have switched. But now that I'm talking to you, I'm thinking maybe we should eat some grass-fed meat in there. And the reason we did this was for his blood pressure and his cholesterol. And can we go into that discussion?
Sure. Yeah, we can. Let's see where that goes.
Okay. Is there because this is our last section.
Mm-hmm.
So is there something that you would like to bring up, or?
I do want to talk about the importance of curcumin, which is extract from turmeric. Are you familiar with curcumin?
Mm-mm.
Because everybody needs to be aware that there's just so much research on that and how helpful that is for dealing with inflammation, helping with neurodegenerative conditions, even like post-stroke and cancer, and the list goes on and on.
What is it, a spice?
Yeah, it's an extract from a spice, which is like used in India a lot, but it's super popular. It's in the news. Most people
Turmeric,
know about
right?
that. Turmeric.
And that was in that movie.
Was
they
it?
were talking
Okay.
about that, yeah. Because I used it for the first time. I probably have eaten it and didn't know I ate it.
Just think if there's anything else to talk about. Would it be okay to mention that we have, like, all my lectures are online at the Pilgrims Market
If
website.
someone wants to go and look up something, some information.
Yeah, and a lot of talks I've given in the past are online there, and then we regularly have people like myself come in, almost weekly to give lectures.
Okay.
At the Pilgrims
We
Market.
can say that, because at the end, I'll say if someone wants to get in contact with you, how they can get in
And
contact.
and also let them know that we have a clinic inside the Pilgrims Market.
Okay, we can say that.
We'll see patients too.
We can say that.
Okay.
Okay. You ready? Okay. And we're back. This is Connie Clark with Home Helpers, and we're on the Senior Moment. And today we have Dr. Toby Hallowitz, and we've been talking about nutrition and seniors, and I have been personally relating some of my health problems to him that I'm sure a lot of people, as they're getting older like I do, osteoporosis, arthritis, that sort of thing. And there's been a movie that I've heard a lot of people here locally have watched, and it's, I think, Forks Over Knives or Knives Over Forks or something like that. And it's talking about how the way you eat affects your health. And my husband and I saw that, and we decided we were going to go on this mostly vegetarian diet. The only thing that we eat other than that is fish, which I'm glad you said that fish is good, because we eat that about once a week. But now I'm thinking that I may want to bring in one meal a week with the grass-fed beef. And the reason that we did this diet was because his cholesterol was going crazy and his blood pressure was going crazy. And so we've seen it start to come down, but still the doctors are saying this isn't yet where we want to be. So I'm learning this about the vitamin K2. Is there anything else I need to know if I'm wanting to make us eat healthier, so that all these health indicators come back in line to where they're supposed to be?
Well, we know that there are alternatives to help bring the cholesterol down. I mean, that being said, cholesterol is not the complete picture for cardiovascular prevention. There are markers, and we understand how that can be a part of that it's an important marker to bring down. But it's all about, like I said, balance and going back to these changes that you can make to be healthier.
Yeah, because, we have made changes, and his numbers did come down, but I want him to go even further. Yeah, and I want him to be healthy, and I don't want him to be on all these different cholesterol medications that aren't good for his liver and everything else,
Right. So dietary changes that are, really important. We know how important fiber is. So keeping the fiber up, eating a lot of vegetables, steamed vegetables, raw vegetables is really important. High fiber breads, staying away from the simple carbohydrates is one of the most important things that you can do. We know that with weight loss, that's going to be really helpful. We know that with, the whole reason for bringing down the cholesterol has to do with preventing cardiovascular disease,
right,
preventing heart attacks and strokes. And we know that being deficient in certain vitamins like B12, B6, folic acid, and looking at homocysteine levels is really important. But so is inflammation. And so dealing with inflammation, we know one of the sort of key components of dealing with a lot of the health conditions that we have of being a modern culture, such as obesity and diabetes and cardiovascular disease, high blood pressure. These things relate to inflammation. So doing things to bring that inflammation down is going to be critical. That's one of the reasons that fish oil is important. Antioxidants are critical. So berries, for example, like blueberries and pomegranate juice, they all work on these different factors and biomechanisms in the body to decrease inflammation. So focusing on the diet to help with weight loss, but to make sure that you're decreasing these processed foods, and particularly these omega-6, these vegetable oils, decreasing that is going to be critical. And I don't see a problem with eating grass-fed dairy and grass-fed meats and even butter and eggs. There are so many important nutrients in these foods that I don't think that they should be avoided. Now, sometimes, when you've lived your life a certain way up to you get to a certain point, a lot of the damage maybe has been done to the way your biomechanics are working, the way that your cells are functioning, and your sensitivities to insulin and glucose and these types of things. So you definitely need to make those changes, but I would add into what you're talking about, making sure you do some things to decrease inflammation, like the fish oil, but also think about like turmeric, which is a spice from India that's we see it a lot in curry. There is so much research on turmeric and how effective it can be, but you want to make sure that you can use it as a spice, and I would recommend that but there's a lot to be said by taking a supplement, and you want to use a supplement that can help with its absorption. Curcumin, which is one of the bioactive compounds in turmeric, is really important for dealing with inflammation, and it actually crosses the blood-brain barrier and can go to the brain and can help with cognitive function and neurodegenerative conditions, and even like post-stroke conditions, and help your mind recover. It helps with arthritis. It's very, very helpful for Crohn's disease and colitis and autoimmune conditions in general. But it's a fat-soluble nutrient, and it can be very hard to absorb. And so there's companies that make some better quality absorption. I like one that's called Mariva, and there's a few different companies that sell it, but it's bound to phosphatidylcholine, and it really gets into the bloodstream and can make a huge difference. So when you're looking for curcumin, ask somebody to help you find one that that you're getting and you're absorbing it and getting enough of it.
It's interesting that you keep bringing up the inflammation because, as we all get older, our bodies start to hurt. And when you move and it hurts, you stop moving. And then when you stop moving, then you start gaining weight, and then your muscles, go down. So it's like this cycle. And I know we work with a lot of seniors that the way they eat now has changed. As we're growing up, we may have ate good, we may not have, but as people get into their 70s, 80s, and 90s, they start decreasing the amounts that they're eating because they feel like they're not hungry, or they don't need it, or they don't feel like eating, or they're depressed, or whatever. And now even those things that they were eating that the nutrition was there is no longer there because they've stopped eating, and they eat a lot of the frozen foods and things like that.
Yeah. And one of the ways that we got into this SAD diet, the standard American diet, was people telling us how important it was to eat fat-free, right? So we're eating these fat-free foods that are very high in sugars. And
sodiums. I mean, the sodium level is crazy when you look at the boxes.
Right. So I think, trying to stay around the perimeter of your grocery store where all the meats are and the fresh vegetables are and the dairy, and staying away from the box things as much as possible. Now, I know that it can be difficult. I work with a lot of elderly people where it's real difficult to cook, and it's difficult to go and get the fresh ingredients.
But you don't want to make something for one,
But frozen vegetables are still vegetables, and if we can get whatever it takes to get those vegetables in, it's really important. But there's a lot of fresh fruit. I mean, we're fortunate. We're moving
we've
from
got
West
some
New York
good stuff.
All the apple country that we're in. It's
and our farmers markets here.
Yes. So I mean, that's probably the best advice I can give is get the fresh, get the natural, eat organic as much as possible. But if you can't do that, if you can't afford it, just get more vegetables in. If you can get whole grain breads, or even better, sprouted grain breads. And we're fortunate here because not most of the country, you can't go to the store and buy raw milk. We can get raw milk here. Now, you need to be a little bit careful with that, depending how sensitive your stomachs are. But for the most part, raw milk is safe for everybody to drink. And there's some really good benefits from that. If you get a chance to read a book, we carry it at the Pilgrim's Market. It's called Deep Nutrition, one of my favorite books. And it looks at why are we as a culture overweight. And since our culture is so focused on beauty, why is it that makes somebody beautiful or strong and athletic, and maybe the second or third sibling not? And a lot of that has to do with nutrition and caring for your body the way it needs to be. And then there's something called epigenetics. When you're looking at the study, we've heard this before, nature versus nurture. Is it our genes that make us a certain way, or is it what we eat or how we're cared for, or emotional things that do it? Well, we know now there's a whole growing field the last 10 years called epigenetics, above genes. And what that means is what we're exposed to, both nutritionally and also emotionally, and even spiritually, and with our faith, how that can have an effect on what genes get turned on and what genes get turned off. And it's basically the control switch for our genes. So it gives us faith that we can make changes in our body based on what genes we were given. There's a great book by Bruce Lipton called The Biology of Belief. And that's another great read that goes into epigenetics and also talks about how faith and nutrition and how that affects not only you, but we know that these things can get passed down generations. So what nutrition you have now and your emotional state can affect your grandchildren and your great-grandchildren.
Oh, interesting.
And that gets passed on. So it's an interesting field. We're learning more and more about it. And it really does relate into nutrition and how you take care of your body.
And that is so important. I mean, it's important as you're growing up, but I guess me personally, it really didn't start making a real big difference to me until now. I'm, approaching 60, and now my husband has high blood pressure, and they're concerned about his cholesterol. And I'm thinking, oh my gosh, I really need to get this in line because he's going to be with me for a while. I'm going to make sure of that, and me too. So you start really like scrambling at the last minute cramming for the exam, and you kind of go, okay, what do I need to do here? How can I fix all these things that I've broke for 60 years?
But there are a lot of things and changes that can be made now that will have an effect for you and as you get older. And it's never too late. And I would highly recommend, that you work with somebody to help make sure you're eating the right foods and you're on the right diet, and that there are certain key supplements that can make a huge difference in your life. I want to mention, you asked about cholesterol, and I wanted to say one more thing about that I know that there are some natural products that can be helpful to lower lower cholesterol if you're averse to taking medications. And a lot of times people don't want to take statin medications because of the side effects, the muscle pain, the leg pain. And this is an important point that people should be aware of. A lot of the side effects from the statin medications to reduce cholesterol occur because it depletes CoQ10. CoQ10 is a nutrient or a component in your cells that's really responsible for providing energy to the heart, energy to the muscles. And so I really feel like anybody who's taking a statin medication should be taking CoQ10.
Well, that makes sense because his doctor had told him if he went on this other medication, he needed to take CoQ10 and some omega pills. And that's interesting that you said that's because it depletes it from your body. Interesting.
Yeah. So talk to your doctors about that if you're taking it, to add in the CoQ10 as well.
Well, you have just been so full of information. Like I said, I could sit here and talk to you for hours. You had mentioned that you do different lectures over at Pilgrims, and those are available to view online if
Yes.
someone wants to look at them. And does it say the different subjects that you're talking about?
Yeah, it's all registered through YouTube. So my lectures are on there, but we have people come in on a weekly basis to give different lectures related to, like we showed the movie Forks Over Knives there.
I think that's how it started around here.
We bring in different movies, we bring in different lecturers on various subjects, all very interesting and experts in their field. And we are currently trying to promote integration with the medical community. And becoming a resource for the medical community for those who want to do things more naturally. And we're about integration, and that's why I chose to become a naturopathic doctor, because there is a time and a place for Western medicine, but there's also a lot that can be done naturally, and that's really the approach that needs to be taken.
Well, and we all want to control our healthcare costs. And if we can do something that changes the way we eat that's going to affect how much we have to pay for medications or whatever down the line, it only makes sense that you would do that up front, cost effective.
Yeah,
so
and we've known for years, I forget if it was Hippocrates, but the expression, food is medicine, and we need to think of it that way.
So it's not only important as you get older, but even before you, because you had mentioned in childhood is where your bones start developing. Now, if someone wanted to get a hold of you, how would they do that?
Well, they can call the clinic. It's the Pilgrims Wellness Clinic at 208-676-0400. Also, our website is pilgrimswellnesscenter.com. And also the Pilgrims Market. You can stop into the market, come in. I'm on the floors there Wednesday afternoons in the supplement section, available to customers who want to come in and ask me questions.
So just ask questions.
Yeah.
They can come in. You don't have to come in and buy anything. You can come in and just ask questions.
That's right. And then a lot of people don't realize this, but we actually have a clinic inside the market. And so where I see patients, we have somebody who does chiropractic and massage and rolfing, and we're bringing in and forming our team, making the clinic a place that can, coordinate with the community. We're all about reaching out and trying to be there for this community. I'm thrilled to have moved here and to become a part of it.
Well, we are very happy that you're here. Thank you. Again, this is Connie Clark with Home Helpers, and you've been listening to The Senior Moment, and I hope you have a wonderful and beautiful rest of your weekend. Good day.